Set up interactive. Damn. Okay. Go back to Zoom. All right, we are officially live. Hello, everyone, and greetings to you all. My name is Pamgrace, and I am the founder and CEO of DiscoverU Health. And I am so excited today to welcome you to another beautiful episode of Health Talks. Today, we're going to be discussing the big COVID-19. We're going to be discussing testing and vaccine. And I have two wonderful guests who are going to grace us today and sharing some valuable information. So definitely take some notes, get involved, make sure if you're able to send us any questions. If we're not able to answer live during the live, we will follow up and either engage with you directly through a chat forum, okay? One quick disclaimer that this is just us as professionals in our various industry, just giving you some information, opinions, observation, and just also some expert counsel. Feel free to use that information at your leisure, but more importantly, be motivated to self-study, right? To do some research and self-study. All right. So with that being said, let's get this thing going, guys.
Let's get it. Let's get it.
All right. So we have the wonderful Army Staff Sergeant Donita Adams. She is here with us. If you can please introduce yourself to everyone.
Hello, everyone. I am Donita Adams. I am a coach out here in Montgomery County. I'm also a soldier as well. And I do other various activities, have a podcast as well. So I to serve in my community, various responsibilities, but I can go in depth about that a little bit later, but definitely a pleasure to be here and thank you for having me here today.
Definitely. It's a pleasure to speak with you today. Also, we have NIH scientist, a research in vaccine research, Deonte Tolliver. Can you please introduce yourself?
Yes. Hello, everyone. My name is Deonte Tolliver. As Pam mentioned, I'm a scientist at NIH doing vaccine research. I've been in the biotech industry for about 7 years now. For that, I studied at the HBCU called St. Augustine's University, studied biology. So I have a various of science background. Along with that, I have a lot of other ventures as well. Entrepreneur, you could say. So other than that, let's get going.
All right, perfect. So, a lot of us have been greatly impacted by, obviously, the health crisis that we've all experienced called COVID-19, also known as the coronavirus. And as to date, in regards to the United States, there is 3.5 million confirmed cases, about 1 million recovered cases, and as far as casualty or deaths, 138,000. Okay, and so I wanted to give those numbers just so we can understand the impact this virus has had on us in just a short time, that it really has impacted us substantially. So yes, so as we begin this conversation, I really want to talk about the impact of first responders and how first responders have been extremely instrumental in really tackling this virus head on and supporting the livelihood of the United States residents. So I actually took the liberty to define what a first responder is, and here's one definition. It states a first responder is a person with specialized training who is among the first to arrive and provide assistance at a scene of an emergency, such as an accident, natural disaster, or terrorism. Such individuals will be emergency medical technicians or EMTs, paramedics, firefighters, police officers are all considered first responders. Now, that sounds normal. Like, well, of course, we'll consider a police officer, a firefighter, first responder. But I believe what's been so unique about this pandemic is that it has required all of us to respond, right, and act in that capacity of a first responder. So if you guys can both explain what your role has been specifically in responding to COVID-19 as a first responder.
Yes, I can go ahead and go first. I don't know, it can be on me. So my position in the Guard is a state retention NCO. So during this pandemic, I was able to help out with joint forces and the operation that goes with that. And with joint forces, it includes Army and the Air Guard. And with that, we call it JRSOI. So JRSOI stands for Joint Reception, Staging, Onward Movement, and Integration. And with that JRSOI, it's the process of transitioning with soldiers. So getting the soldiers that are out there for state activation for this COVID-19, as soon as the governor said, hey, we're gonna activate the Guard, that's what we did. We pushed them out, got the personnel out there. Then we had equipment. So anything from the trucks to the Humvees was included in that. And the last aspect of that is the materials. So anything from the food and the water, which were for our community, which we needed to serve, and also the medical supplies that we needed to test for this COVID-19 was included in the capability of meeting the commander's operational intent. So I was able to serve in the capacity of pretty much like ensuring that my soldiers had enough time on their contract. So they come in, let's just say a soldier initially has like a 6x2. That means they serve 6 years in the Guard, which is their contract time, and then they have 2 years that can go into the reserve time. So my job is if I see a soldier that is, let's just say, for instance, we talk about this pandemic, right? The pandemic, they got assigned to push up in March. Let's just say their contract ended in April, right? So if I see that that's a red flag for me, I have to that I extend them out enough for the mission to get complete, because it's hard to task a soldier out if they're not ready and fully capable to meet the need of the community and also the governor. So that was one of them. Another one that I had to also do was just maintain incentives and benefits. That was key. So making sure that soldiers didn't have any issues with them, or making sure that their GI bills were correct, or anything as far as that benefits goes, we had to concern that. And the last thing was the command climate, and the command climate is key, right? It goes with the cohesion, making sure that they're not disgruntled as they're out there, because that can cause a friction in the mission that we have. So that was my full capacity in this COVID-19, and it was definitely rewarding and helping our soldiers and helping our community.
Awesome, awesome. Deonte, Mr. Tolliver.
Yes, definitely. So I played a slight role in the COVID-19 process. Just if you've never been to NIH, it is a huge campus. We have plenty of different areas of where science is being constructed and tests are being done and all the above. So I'm just a part with NIAID, which is not, where basically Dr. Fauci gave us a part where we specifically do a lot of HIV vaccine research and try to produce a lot of vaccines for HIV. We branched off and got into different things like malaria and then of course COVID. So really we're just doing a lot of development work, trying to figure out, scale up a vaccine for COVID, gathering data, sending it off to the FDA, and just basically just seeing how we can create this vaccine as quickly as possible, but mostly efficient. And so that's really the biggest role that I've played in for the most part. So
awesome. So of course, everyone has something to say about how the United States has responded, right, to this great pandemic. And to be fair, you know, I think this is beyond all of our understanding. I don't think, even if you knew it was coming, I don't think you knew the magnitude of what was going to take place. But the United States has faced criticism due to the lack of pandemic response strategy. So per your observation, how do you think we're handling COVID-19 now, prior to its prior to the beginning?
You can go ahead, Donita.
Are you sure? I like to look back when I think about certain things and when it was all founded. So like in 1990, President Bush came out with the President Council for Advisors, and that included with the science and technology and everything. So he put a lot of funding in that, and that would help and prepare us for these pandemics or these viruses that would come our way. Obama actually too, he took over that, and when his presidency happened, and enforced an infrastructure, you know, that was put into place and kept the funding going and made sure that we had the adequate amount of advisors to, in case this thing happened, to catch it early. I think in our current presidency, it was something that they neglected. They defunded it, and the issue that we are literally having right now, it caused us to have a weak infrastructure, which didn't prepare us for what was going to happen. Like you said, the magnitude of this. So pretty much we're suffering right now from this pandemic, you know, without a plan. We didn't have anything set in stone from the beginning. However, now, honestly, I could say, and I can only speak for Maryland because this is where I'm at and this is where I'm observing a lot of things. Governor Hogan has done a wonderful job in implementing the 3 phases. If you look at some of our numbers in the beginning, we spiked really, really high. That's when he went into the 3 phases that we had. Montgomery County and PG County really had high numbers. And I think with him advising on his own, because he wasn't really listening to anybody else, he got his own team in. He literally got his own doctors in, you know, people that were knowledgeable and experts in that field. He got them together. He made a decision on, all right, this is implemented from here on out. And if you look at the numbers, like I said, in May and June, they were up. But as soon as different phases started happening, phase 2, you know, everything seemed to be fine. Even after the 4th, the holiday for some people it's not a holiday. But for the 4th, you don't even see an increase in spike. It's a slight spike, but it's not enough that will cause a problem. And I just think that overall right now, honestly, I can say that we're doing a good job in moving forward. But in the beginning, we didn't have a good plan set in place.
Yeah. So I wanted to kind of touch base what Donita kind of said was, you know, presidency, unfortunately, he cut a lot from us. We were actually doing a lot of research on SARS, MARS, and COVID since I want to say 2003, since MARS came out, and SARS. So we've already been doing this research, and we've already been kind of transitioning into the U.S. already understanding and knowing this was going to happen. So I believe that we failed in handling this situation just because they knew it was coming. We've been doing research for it. That's why we were so quick to be able to get into our phase 1 studies and phase 2 studies. I know currently NIH, we are in a phase 2 study, which we still have a long way to go, but coming from just being in January when all this supposedly been out, we could have got a jump on this back in November. Mm-hmm. But people think that it kind of came out in January, but it's been way before that. I think China's seen their zero patient back in early November, early November, early December area. So we definitely could have gotten a jump on this way faster, but of course, not to be political, but We have a presidential team that I don't think is aware of the magnitude of this virus. So we definitely could have got a jump on this way earlier, and I just don't think we did at all.
Yeah, definitely. And even for myself, just, being in the healthcare industry as a healthcare provider, but more so on the community level, in which we are directly providing services at people's home, or I interact a lot with like hospitals, rehabilitational centers, like doctor's offices, like primary care offices, assisted livings. Everybody had to go on a shutdown. You cannot enter there unless there was an extreme emergency of some sort. So that really hindered our ability to communicate and network with various lines of businesses, especially us as healthcare providers, being able to properly support each other, right? I believe that was greatly hindered, primarily, like you said, not having a one strategy, a one plan that was disseminated across everybody, so that we're able to follow it. We know who to reach out to. We know how we can support each other, and what each person was capable of do, how we're able to scale. Some people probably able to scale faster than others. And so definitely like a learning opportunity. I'm sure there's been a lot of study, and there'll be continuous study around this historic time period. But definitely us as first responders, I think it's important that we always own up to our responsibility and always be ready to pivot, right? And to pivot with confidence, and more importantly, to make sure that we're supporting the people that are under us, whether it's our clients, whether it's our residents, whether it's the people that are going to be utilizing the testing or utilizing the vaccination, making sure that we are properly protecting all users. So this is a great question for you, Donita. I know you're very instrumental in creating one of like the first major COVID testing sites in Prince George's County, particularly FedEx Field. Like, how was that experience? Really putting that on together. I know you didn't do it independently. I know it's definitely a collective effort, but can you share your experience?
It definitely collective. We had soldiers assigned out there. So we had our MP units, our military police soldiers that came out there. We had transportation, and we also had our medics. And our medics were very key. And we understand that we know that there was like a limited or scarce of like, doctors and nurses and RNs, and everyone was getting pulled and everyone was getting stressed. So our medics played a key role in that. And we were able to provide, tents there. Normally those tents would not be in that type of environment, more in a tactical one, more on deployment and things like that. But we were able to set up those tents. And the important part of that tent was for, medical treatment as far as anything with COVID. So if anyone felt like they had a symptom, or if they were unsure, they might have been around someone who tested positive and they were just like, I have to get tested. It was a central location where we had, people come in and come together and try to figure out what we can do to help our community. So just to be there in that atmosphere, and actually we had an opportunity to get ESPN in there and record me walking through and talking about what we're doing and how we're helping our community, and just how we quickly, and it took a complete team effort. It wasn't just one person, everyone came together, and that's what we do as guardsmen. We're different from your active duty and your reserve. We come in and we help our community through any disastrous, inclement situation. Like, we are there to help and to serve. So to get that experience, to be at FedEx Field when that is an environment for athletes who are performing at an elite level, but now it turned into, hey, we have a crisis and now we have to help. It was important, and it definitely reflected well on the guard, and not only that, but just the people in our community.
Awesome. Definitely. That's quote unquote going to be the former Wrestling Stadium. Not trying to get involved in that, but former.
I'm glad they're changing the name. It needed to be done. Unfortunately, I'm glad that it's changing, but it's sad to say that it had to change because of money. You know what I mean? Like, that it shouldn't have came down to that. It should have came that this is the right thing to do because it is right, not because someone's pulling my pockets, or I have some legal have to work on. No, it should have been because this was the right thing to do at that time. But I'm just glad it changed. God works in mysterious ways.
Yeah, definitely. It's going to be, I think there's such a newness in the air, right? And so, although it could have happened earlier, it's almost like this is also like perfect timing, like let's just change it all, whatever that's not right.
Everything's changing. Might as well let's keep going. Yeah, let's keep making change. I think it's important.
All right, so our scientists here, Deonte. So while everyone wants COVID-19 vaccine to be developed ASAP, everyone wants a vaccine. Everybody is like, we want to go back to normal. We want the schools to be reopened. I'm tired of being quarantined. And also, like, I'm tired of the government telling me what to do, right? People want to obtain autonomy over their life again, right? And that level of freedom. But how important it is, or how serious it is to not skip important steps in development process, because it definitely poses serious risk and serious problems if we do try to streamline, those necessary preventative measures. Can you explain why that is so important to just really have like more of like a safe and approved vaccine?
Yeah, I would say that the biggest thing is, just in my opinion, is until we get to a safe vaccine, people do need to understand that they do need to either quarantine or they need to wear their masks, they need to wash their hands. And I don't understand why we need to repeat that to people, but fortunately we do. So that's just the first step of controlling the virus. And then as far as having a safe vaccine, you definitely have to create time, because honestly, for you to come out with a vaccine, it takes at least a year and a half, just through all the steps, from the exploring all the information and seeing what's going on and why this virus is spreading and how it's spreading and what is it. And unfortunately, this was another case of basically like SARS and MARS, of course. So it's not something that we haven't seen before, because we have, but it's just more at a hyper level. They didn't understand the severity of this. So after exploring it, you gotta go into your preclinical stage. And that's where I actually come in, where we do our development work. We do a lot of our benchtop work and small scale stuff and figure out how to properly grow cells to create them the proteins, which then creates them to antibodies to help protect you against the coronavirus. So once you do that, you then have to submit that information to the FDA. So that right there alone is a good 6 to 9 month process. And that's before just you doing the research. So you're looking at almost 2 years right there. And you have 3 to 4 phases where you have to do tests on people and animals, then people, which is your preclinical stage. And then you have to submit all that data, all that information to the FDA. The FDA has to then decide, like, hey, this is good. We approve you for another phase. You go through that phase. They want to know the dosage, because you can't overdose your patients because you'll kill them, or you'll give them some type of severe side effect where they could be permanently damaged somehow, some way. So that right there alone, speeding up a process for a vaccine will do worse than what the virus would do. So that's something that's definitely big, that you kind of have to take a step back and just let science do its work to properly vaccinate people, or to properly put people in place where they're able to be protected, because you can't be protected from medicine that's going to harm
you. Definitely. No, that's very insightful. What you're saying is don't rush the process, like these are our lives at stake. And so although it sounds good, like, oh, I want a vaccine, do you know what that vaccine could do to you, right? And if we don't allow, like you said, science to do its thing and allow proper time, then really what we're doing is hindering ourselves and causing more potential casualty or catastrophic bodily harm, right, to our bodies. And so, and that is, you said more disastrous, but I think it's all disastrous. But I think the best thing we could do at this point is try to protect ourselves and our humanity as much as we can by like utilizing science research. And one thing that you said that was very interesting is this is not new, right? That you guys have been studying this virus and other similar viruses, but it's more of a hyperactive virus. So really taking time to understand this new strain is also, we need that. We need you guys to do your work. We don't want you to skate and shortcut. You know, it's not the time for shortcuts.
Yeah. That's when it hurts us, when you stop funding. You know, when you stop funding from doing these things, from having this type of, you know, situation to happen, you cut science, you take shortcuts, and now you're in a situation where we're in a pandemic and you have people not listening. You have people listening to somebody who doesn't have science experience. They're just going off of what they think they want to think. Mm-hmm. Something that you have to pay attention to the doctors, you have to pay attention to the scientists, you have to listen, and you have to do things properly to protect yourself first.
Definitely. One thing that I've learned through my research is that a lot of people are apprehensive about taking any form of vaccination, especially people of color. During my research, I learned that I guess there's, in 2013, when you guys are creating a vaccine for the severe acute respiratory syndrome, which you mentioned is SARS, they found some vaccinated animals develop more severe disease compared to unvaccinated animals that were exposed to the virus. That was really interesting. You know, that this subject group, which is vaccinated animals, you know, were more susceptible, you know, have more casualties than the unvaccinated group. And I think a lot of people feel that way, even when it comes to like taking like the flu shot, like, oh, I haven't had the flu. If I take the flu, I'm gonna get the flu. You know, a lot of people feel that way. Like, how do researchers avoid like negative outcomes or symptoms when creating a vaccine?
Well, first of all, people have to do their research, for one. I think a lot of times data comes out and it could be false, or they could put the data into a perspective of where they want that data to represent. So you definitely have to understand that portion and do your own research first. And then secondly, you just want to make sure that medicine is very important. I wouldn't say, I understand the history of why people of color do not want to take these vaccines. I totally understand it, but in this case, when this virus doesn't discriminate, what are you going to do? Or are you going to take the vaccine? Or are you going to just decide to ignore it and just say, no, I'm just not going to take it and hopefully I survive? You know, so it's kind of a thing where it's up to your discretion, because I can't tell someone to take it or not to take it, because I understand it. I don't take flu shots. And I did a lot of research on, I've done a lot of research on flu shots. I used to work for AstraZeneca, and the past 3 years that's the flu shot that's given to doctors every day. I mean, given to the doctor's offices every day. And those are the ones that kids are taking or adults are taking. So, you know, it's something that you just gotta have your own discretion about. And you said something where people take the flu shot and they get it. You do, because what they do is they put a strand in your body so your body can recognize the flu. So yes, you may get sick because your body doesn't recognize it, but you won't get as sick as if you would if your body didn't recognize it at all, and then that flu turned into a pneumonia. So you gotta understand side effects behind it too. You'll rather have a less severe side effect than a major problem like pneumonia, where you could potentially die, or in the COVID sense, you get on the respirator, and once you get on the respirator, you no longer can breathe on your own. So the chances of you living are very slim.
Okay. One thing is, guys, use your own discretion. Also, the one thing that's been really great about being quarantined is the ability to self-study. I've been saying that a lot, where, you have time to research, you have time to read, you have time to really just dig deep, right? And not just on a surface level, but really get some more in-depth understanding, or even reach out to subject matter experts in your community or even within your family. A lot of people, even such as myself, I have friends that hold various positions that I don't even think about. Sometimes you may not even know that your friend knows this amount of knowledge or has access to this information, because we only look at them in one facet. And I think this time is helping us to really look at the multifaceted aspect of not only our history, but also our friends, our family structures, and also just the type of information that's out there, so we can make really insightful and informed decision when it comes to vaccination, when it comes to testing, or any other health need that we may encounter or go through. So definitely use your own discretion, though. Educated discretion. One thing that I think has been an overarching message is the broken trust in public health officials and people of color. There's been a historic line of trust, of abuse of trust, right? When it comes to our authority figures, our public leaders, or public officials. And in actuality, we want our public officials to truly care and seek our interests and seek our well-being and seek the well-being of our family. And once that's broken time and time again, it creates a moment like this where, oh my gosh, you're making a vaccine, I could benefit from it, but I think I might take the chances of not taking it, right? Right. Of course, you guys may be familiar with the Tuskegee experiment. So back in 1932 to 1972, the U.S. Public Health Services conducted a study of the effects of untreated syphilis in Black men. And this was done in Alabama, actually. And so as a result of the Tuskegee experiment, many African Americans developed a lingering deep mistrust of public health officials, in part to foster racial clarity. President Clinton issued a 1997 apology, okay? And this apology, just a little excerpt from that apology. The U.S. government did something that was wrong and deeply profoundly morally wrong. It is not only in the remembering that shameful past that we can make amends and repair our nation, but it's also remembering that the past that we build is also remembering the past that we can build a better present and a better future. I think that was really deep, for the president to say that and to say, hey, like, we did something wrong, like profoundly morally wrong to this group of people. And that because of this past, that we have to really mend fences and repair that, not only by apology, but also commitment to doing better now and tomorrow. Kind of what are your thoughts about, just the history or the broken trust around people of color and health officials, and that statement from President Clinton?
Go ahead, Donita.
Yeah, I can go. Take it over. I'm big on action. Words are key, but I'm big on action. So you have to look at how the presidents are responding, or how Congress is responding, or how politicians are responding when it comes to this, right? And I haven't seen that support. So I hear the quote, and I hear, oh, we're apologize for this, but just a lot of things that even we're enduring right now, from police brutality and, the racism and just all of this. You can say one thing, but show me. That's in any relationship, right? Any relationship you deal with, people might say one thing, but then they show you another thing. So I need to see it, because right now I don't see those actions to support that they care about us and do, for the simple fact is that, unfortunately, we're subjected to medical care, unfair medical care, pretty much put it that way, due to racial discrimination. So until I see, the differences in that, what I mean, our Black women are 2 to 3 more times likely to die from childbirth than our white females. You know what I mean? And I need to see a difference when it comes to certain things like that. Sickle cell is another one that hurts the African American community. When I see research is being done to help us in that category, then I can say, okay, I saw the quote, I see the action, and things are being done, and I can support it. But as far as like right now, I need to see more action.
Yeah, I definitely agree. I think that I do want to see more action, especially in science. There's been too many times where people of color have been discriminated against, have been hurt, have been even died. I know it's a cell line that we actually work with that is actually, it was a bad thing that happened to her. I don't know if you guys know who Henry Lax is, but we use a cell line called HeLa cells. And HeLa cells actually heal a lot of diseases nowadays. Unfortunately, the family isn't seeing too many benefits from it. But I'm glad that a person of color is helping the community, is helping the world. Unfortunately, like I said, the thing, how it happened, it's terrible. But we now have somebody who they call, immortal. Her cells were immortal, and her cell line just pretty much helped out with countless numbers of vaccines and different type of medicine and some of the foods we eat. They have this HeLa cell line within it. So again, it's terrible to see our community go through the racial discrimination that we go through. But we as people have to do better for ourselves, first of all, by eating better and taking care of our bodies, so we don't have to get to that situation where we have to put it in a doctor's hand or science hand to figure out how we're going to stay alive, when we should have started from jump. And then that goes to the doctors. They need to do better with people of color. There's so many wrong things that I hear about, especially I know like people that are on Medicare and Medicaid. A lot of times people go to the doctors and they get generic vaccines. They don't get the real vaccine because of their insurance. So you have, people in office taking away Obamacare and doing certain things like that. People aren't really getting their proper treatment due to, politics. So it's very important that we go out and vote, and we vote for the right people, and we do what we have to do to put the right people in place, so we are able to fight against this discrimination and change the way, I guess, society looks at people of color.
Ooh, y'all hit me with so many jewels. Okay, let me go through. It was all good. Donita, you said something which is, I wrote here, the quote plus action equals trust. That's the algorithm that I put together. Speaking about it, apologizing is step 1, but we're not able to get to step 2, 3, and 4 without the action. The action is so required from the African-American community to really build that bridge of trust with our health officials, but then also build that racial trust. And I believe it's owning your wrong, but then, like you said, making direct day-to-day actionable items. So therefore, we have to be on top of mind. We can't be a has-been, or okay, that was an issue that was a long time ago. No, it has to be, we always have to be at the forefront of conversations and the forefront of protection by the healthcare officials, that they should protect us always. And I think with us being on the forefront, it'll also dictate their thoughts, their conversations, their behaviors, and also help to mitigate any type of racial bias that exists within them personally, and also holding their peers accountable for any racial bias that may oppress us as a racial group, right? Because if we thrive as a Black community, and all of the different communities thrive, we're able to also to bring forth and be a true contributor to this great land called America, right? We want to truly give back and contribute. So when we pass on, you know, we're leaving something beautiful, right? And we added value to this great land. So action is key. So health officials and myself, Pamgrace, and all of us as first responders, we have to do better to take in personal accountability to act, you know, because also not only are we looking at our presidents or our government officials, but people are also hearing the words that we're saying, you know. So me and my seat, or you and your seat, in our various areas of influence, as we say we're going to do something, or we need to follow up with that action to build that trust, you know, and for the certain doors to open to us, and so that people can respond to us differently. So that is super huge. Another thing is just the ongoing systemic racism in healthcare. You mentioned Henrietta Lacks, and I know that she lived in Baltimore. I'm not sure if she was from Baltimore, but I do know that she lived in Baltimore. And considering the fact that Baltimore is literally in our backyard, and the testing actually happened at Johns Hopkins, you know, so there's such a deep scarring when it comes to one of the nation's leading health institutions in the world, right? And also the fact that the dark history, you know, of Baltimore, and the dark history of Johns Hopkins, and actually having them being also the headliners, right? And actually trying to break that racial bias that exists in those dark rooms, right? In those surgical rooms, in those in the classrooms, and anywhere else, you know, on the website, anywhere else where they're sharing information, they need to be factual and honest in their misconduct, but also factual and honest on the actionable items that they're doing, and continue to be committed to build trust in their community. Unfortunately, like you mentioned, insurance discrimination, it's just a lot. It's a lot for a lot of people to process. And that's why this forum is so important, because I want to get people thinking. You know, it's a lot to digest, but healthcare is a part of your life. And one thing you said, Deonte, was we have to take ownership and responsibility for our health. That's key. We can't blame everybody for everything, even though we can rightfully point fingers. It's also important to take personal accountability and ownership for the daily decisions that we make that compromise our health. And so as a person of color and as a healthcare provider, my big ask to my community is, what are you doing to take personal accountability to truly achieve the best health outcomes for you, to truly be healthy, to truly be whole, to truly break any type of generational illnesses that plague your family, whether it's, you know, diabetes or cancer or anything else that is either maybe genetic or maybe just something that's a byproduct of our daily behaviors. So yeah, did y'all want to add something on today? 'Cause I feel like that was a mouthful.
I'm all good.
You good?
No, that was good.
Yeah.
Okay. Yeah, man, we have
to get what my brother said though about the vaccines. I do want to say something about that, because my brother made a valid point on that one. Is definitely educating yourself on that, doing the research. But a lot of people have found that, you know, with some of these vaccines, that it's linked to some of the diseases that we face in, you know, our community, in our race, right? So one of the side effects that they thought was like, you know, autism, right? That negatively impacted our community. So you get the pros from your vaccines, from like, you know, protect you from the disease, and it's safe and efficient and all those other things, right? Help you prevent the spread of the disease. Then you have your cons where you're like, all right, what's these side effects, right? So you all know you take a medicine, it helps you and cure you in this, and it's like these side effects start kicking. It's like worse than what it was for. So I agree, my brother said, take your time, educate yourself, but just know what you're getting yourself into, because it's very key. And at the end of the day, you're not the guinea pig. I'm the guinea pig from being in the military. So we get all the shots that you can think of first, and then go from there. But definitely educate yourself.
Definitely. One thing I wanted to say that I didn't say, one thing that was what I believe President Clinton was alluding to when he said morally wrong, was the fact that at some point in the whole Tuskegee experiment or the syphilis study, they actually found the cure or the best treatment. I don't want to say cure, but the best treatment, and it was penicillin, but they failed to provide that to their subjects. You know, so to the people that they were quote unquote treating and caring for, they did not disclose this treatment there, you know? And so I think the omission of information is criminally wrong, right? And is morally incorrect. And we have to do a better job, again, of sharing information to our community. So therefore, we're not taken advantage of, because a lot of us, one thing, especially people in urban areas, there's sometimes an educational gap, right? And so no one has people within their community that they can go to and actually do cross-reference, right? So if everyone is the low income, or let's say high school level education, or whatever the case may be, you're not going to go up the road and find a doctor, you know, who's really going to give you the inside scoop, as I can say. So it's really, really important that, I don't care what color you are as a health official or a healthcare provider, it's your duty to be honest and share the right treatments, and giving your participants a freedom of choice, but also giving them the right information so that they can make an insightful decision. So yeah, I got another question for y'all. This is gonna be a good one. Obviously, considering our political climate, many leaders have been speaking up and advising their communities. Okay, so I'm gonna reference the people of color community, or African Americans. So on July 4th, Honorable Minister Louis Farrakhan warned Black people. He said, in quotes, "Don't take their medicine. I say to you, my brothers and sisters in Africa, if they come up to you with a vaccine, be very careful." Like, what are your thoughts about that overt warning to us as a people around medicine and vaccination? And Deonte, go ahead.
I would first off just say, speak with a professional first. Although, you know, I listen to a lot of our Black leaders, and I agree with them at times. But being in vaccine research, it's something that I can say that it's things that we can take to save our life. I won't totally put medicine out the window, because medicine has evolved our world for years, good and bad. So I won't necessarily go there and say, don't take medicine. Especially, you know, with us working so hard on trying to create a vaccine, I see what goes in vaccines. So as long as you understand and know what raw materials are going in these vaccines, research those raw materials, see what those raw materials will do to you, or what effects they have on your body, what effects they have on your genetic body, because everybody doesn't have the same genetic makeup. Some medicine may be better for, you know, African Americans or Hispanics or whites or whatever you are. So again, you go back to just doing your research and trying to figure out what's best for you, because if you're on your deathbed and they say, hey, you need to take this, I don't think you're going to listen to Louis Farrakhan and say like, oh, I'm not taking that, so yeah.
Yeah. No, I totally agree with what you're saying. And I mean, there are some people that will deny it for religious reasons, and they totally have that to support them in that. But like kind of like what we stated before with just the disparity and your belief on how that vaccination might cause medical problems later on down the road for you or your child. So it's to your discretion at the end of the day on what you can do. I am not knowledgeable. I'm not a scientist. I'm not making the vaccines. I can only speak as, for myself really on, what I believe, but like, honestly, just educate yourself, do the research. If you don't believe that it's necessary, then don't do it. Now, obviously we have to be vaccinated to go to school, right? At least here in Maryland, Montgomery County, in certain areas. So obviously there's protocols. You have to know if you don't do this, then this can't happen, and you have to do other things. So you have to be mindful of that. One of the things that I am a proponent on, and I'm a big supporter on, is just natural herbs. I'm big on the, not CBD with, I think it's the hemp that's inside of it that causes like the highness and the weed, whatever. Not that so much. Obviously, we can't do that, but the natural oils and, different type of things that you can do naturally, teas, detoxing, eating correctly, those type of things. Your gut and your gut health is very important. So if you take the time to concentrate and devote your time on your health and your gut, other things will benefit out of that. So again, like I said, just educate yourself and just do the things you need to do to stay healthy.
Definitely. Yeah, man. I think it's, I think the overarching topic, when I hear Louis Farrakhan, is really a moment of like caution. And I think that moment of caution is to do your research. Okay. So don't be so quick to jump on whatever is out there. Take a minute, do your research, assess, like you said, whatever elements are in these vaccines, assess various types of treatments that are out there. As Donita, you stated, various natural remedies, natural herbs or teas, just being a true self-advocate for your health, right? Like we all have a independent responsibility for our health. So going that extra mile and doing that due diligence and research will go a long way, and making appropriate positive changes, whether it's taking any type of vitamins or natural vitamins that you could take, or juicing or whatever else. And also, I'm a big proponent of investing in your health, not only just working out, watching your dietary intake, but if you are dealing with various health challenges, seek counsel. The counsel is not only your doctor, your primary care, seek other specialists. For example, like a registered dietitian who specialize in food as medicine and how to properly eat according to your health type, right? Or to your health challenges, and how to make those lifestyle changes so you can really see true benefit, whether it's in gut health or any other health. Another thing is, when it comes to medication, if you're on a series of medication, because one thing is the African-American community oftentimes have compromised health. We have a lot of underlying health needs or health issues. And with that being the case, we're more susceptible to COVID or any other virus because of that. Why is that? Because whether it's genetic, whether it's behavioral choices or what have you, see a pharmacist, actually get a consultation and do a medication therapy management consultation regarding the medication that you take, why you're taking it, dosage, is it appropriate, the side effects of these, because maybe you're not right on the right medication. Is it organic? Is it not? There's just so many elements to health that I think we have to take an independent personal investment to get in that right information. So that's, guys, invest in you.
I will say that if you go to the CDC or FDA website, can see what ingredients are in these medicines that you're taking. You can see the raw materials that they have to announce what is in them. So that's a good way to go out and check to see what you're putting in your body. Like Donita said, I am definitely more of a natural person and try to stay away from medicine as much as possible. But if you have to revert to that, do your research on it and see why you need to take it and what's it going to do to you if you do take it, and what else you can do. Seek other advice, like you said, and just wanted to add genetic testing. Find out what type of genes you have in your body that's hereditary, that you may have a gene in your body of, pre-diabetes or, anything. You can find that out at a very young age before you start to see health problems later on in your future. You can get genetic testing done and they can tell you all the type of genetics that you have in your body that may be pre-lining conditions for later on.
Okay, scientists, we see you. That's why you're on this call, right? So if you guys can both kind of close out with any remarks regarding this call and just highlight either some key things that you said that you want to either restate, and then after that, I'll have you guys share anything else about you personally.
Go ahead, Donita.
You gonna throw my way first, huh? Just picking up from this conversation, I think it's just, very important for one, that we go back to educating ourselves and we go back to, empowering ourselves, inspiring ourselves, and uplifting our community. I think that's important. And just knowing that it takes a village for all of us to get through this. So a lot of us are trying to be, minded individuals. We have to come together as a community. And especially if we talk about change in the healthcare, change when it comes down to schooling, education, to rezoning in our community. A lot of those things, it comes to us coming together. So I think from today, if you don't take away from anything, just take away from the simple fact it takes a community and takes us being one, being united. As far as the vaccines goes, when it does come out, I'm not sure on the projected date. I do pray that it does come out soon. So obviously, we said, look at what's in those ingredients and decide if it's best for you. Social distancing, staying, that 6 feet away, and knowing that, everything is going to be okay. And we'll try to, get through. But that's pretty much a lot of the things that I got today. And I learned a lot too from the science aspect on, just different things about the vaccine and what goes into play and the different phases. So I didn't really know about all the phases that you all had to do. And I really do appreciate, what you do, my brother, when it comes down to that. So take care of us, take care of me. And I do appreciate your hard work.
Thank you. I appreciate you. I appreciate you serving our country. I think, a lot of times I don't think they understand the magnitude of what you guys go through, and health professionals as well. We all go through a very long day and then also have to come home and take care of ourselves and our children. So I think the biggest thing is really just take care of yourself and take care of your children. If we're able to teach our children and show them different, the world will be better. And that's everybody, just teaching your children. We literally could change history with 12 to 15 years, over the next 12 to 15 years, if we just teach our children the right things, just by taking care of yourself, treating other people with respect, and staying away from the whole racial discrimination. And, so I think that's all I really had that I wanted to touch base on. So if you have any questions for me, reach out to Grace or reach out to me on my Facebook at Deonte Tolliver, or my Instagram is DT Credit DT 25. You can find me on there. I also give out a lot of advice on finances and financial literacy and creating generational wealth. with everything that's going on, it's a big thing to get life insurance right now. Don't leave your kids with nothing, you know. Unfortunately, it sucks to talk about that, but you definitely want to have your children in place to have some type of wealth when it's time for any of us to go. And you never know if who catches COVID or catches the flu or diabetes or whatever. You never know. So just make sure you take care of your family first.
Yes. Donita, did you want to like share your way people can find you and what else you're working on?
Yeah, definitely. Yeah, but before I get into that one, I do want to stress the importance of like eating right. The health, you know, there's so many benefits, and research has shown that, you know, with the well-balanced diet that you can, you know, think clearly, you can respond and react to certain things faster. And then consequently, it also, or conversely, I'm sorry, it also shows that when you don't have the proper eating, that, you know, you're more susceptible to, you know, depression, or you can have all these other, you know, negative things, you know, impaired decision making. So I do want to stress the importance of eating right. You know, as a coach, as an athlete myself, you know, I have to make sure that what I'm putting in my body is very important, and to keep me through and to keep me knowledgeable so that I can educate the next person or help the next person in my community. So I want to stress, I don't know how hard I can stress that enough, of just making sure that you eat right. And I understand the healthy stuff costs a lot. But if you can take some time to look over your budget, just look over some of the things that you're spending your money on that you can probably take away from that, and use towards increasing your health. I think that is key. Another thing that I wanted to say is just, you know, keep God first. That's another thing. Your faith is your foundation. And I think that's so important, is if you can, you know, keep God in every decision that you make. And I think you can have a better understanding of, you know, where you need to go, what's your direction, what's your purpose, what's your destiny. And I think once we have that established, we can get through this together as a faith community. And lastly, literally on Monday nights, I have a show. It's the Nene Show. It's built on its mission is to power, inspire, and uplift each other. We actually have poetry night this Monday. So I'm looking for any comedians, anybody that does poetry, raps, sings, anything like that. We actually have a good cast that's coming in. Think about it, I have like 6 different people that's going to do 6 different things, but I'm so excited, and it's something that I like to do, and just to help our community and also educate us. So thank you again for literally having me here. And this has been a pleasure.
Awesome. Awesome. I'm going to close with some comments from Dr. Anthony Fauci, who is, I believe we all know who he is. So I'm going to close with that, and then some other closing remarks. So Dr. Anthony Fauci says that he is consciously optimistic about a coronavirus vaccine. But in the meantime, the virus is spreading faster than ever in the US, and testing sites across the country are being overwhelmed. Another big worry is hospital capacity. Assuming all goes well, there's potentially a reliable vaccine that should be available in the US by the beginning of 2021. So I know that seems like a long time, but guys, people are working really hard to ensure the health and safety of this vaccine. In the interim, please get tested. If you are experiencing any type of symptoms, please quarantine for 14 days. Please, again, social distancing, wearing your mask, washing your hands as often as you can, sanitizing your home on a regular basis, and just all the other necessary hygienic activities. Just being very mindful, even if you're out. I know a lot of us are in either phase 2 of opening in our various counties. Even if we're going out to dinner, just in getting back into socializing, be also very mindful of the company that you keep and their exposure as well. Yes, another thing, guys, I'm just so happy to have these 2 beautiful people here with us today. There was such beautiful information shared. The reason why I create this platform is because I know that there's a gap in my community, especially in people of color, around chronic conditions. Chronic conditions plague our community, and unfortunately, a lot of us lose close loved ones very early due to lack of healthcare, lack of access to healthcare, lack of literacy, access to medication, and so on and so on. And so I want to make sure that we're able to bridge the gap, show visibility, that there are African-American first responders, that there are African-American clinicians, that there is support and factual information out there. But through it all, Deonte, you said, take care of your family, take care of yourself, take care of your family, put faith first. We will get through this stage in our life. And as we come out of 2020, it's going to be a big victory for all of us. Because I believe anybody,
speak it, sis. Speak into existence.
So we're going to get out of this, with health and happiness. We're going to have financial wealth and security. We're going to have these life insurance. If you don't already have it, you will have it. If you need to reach out to Deonte for credit repair or anything about insurance, please do. And also, DiscoverU Health. I want you to learn more about DiscoverU Health and what we're doing to support our community around chronic conditions. There's some top 10 chronic conditions that you guys may be familiar with that are common concerns. I'm just going to list them out briefly. Hypertension, high cholesterol, arthritis, diabetes, heart disease, heart failure, depression, arthritis, Alzheimer's, chronic obstructive pulmonary disease, and kidney disease. So these are just some common diseases that are very prevalent in our community. So if anyone needs any type of support, lifestyle support, just overall healthcare support, please give us a call. We are offering 10% discount on chronic care services. So access DiscoverUHealth.net, DiscoverUHealth.net for more information. And we'll love to support you and connect you with a full healthcare team that includes nurses, caregivers, dietitians, pharmacists. So you're going to get that full wraparound service. So give us a call. All right, guys, this is it. This is it. This is the end of episode 2, which is COVID-19 testing and vaccine. Thank you guys for being with us today. We're done.
Thank you. Thank you for having us.
No problem. So, this is it. Let me pause or stop the recording.